a human eye. And we know on an eye we have the anterior or the front part that we call the cornea. And many times when we are describing it or explaining it to our patients or doing health education, we call this the glass on the surface of the eye. Now, we also have another glass that is inside the eye, and this is what we call the lens. Everybody is born with a clear lens. That is, in the normal situation, the lens is supposed to be very clear and transparent. So this enables light to move through the anterior glass, and then it will also go through the inner glass, and then the light will reach the back of the eye that we call the retina. Now, if this lens becomes opaque, we no longer have something that is as clear as this, but instead we now have something that has an opacity inside, and this is now what we call the cataract. Now, this cataract grows over time. Many times it's slowly progressive, increasing in density, and that makes the vision to gradually reduce. Though in certain instances, for example, if it's traumatic, if something hits the lens, and then there we can have a faster exacerbation of the density of the opacity. But also in situations where people have uncontrolled diabetes, that may also fasten the progression of this opacity. So plainly speaking, that is what a cataract is.
Please raise more the eyes that our viewers could fully see that structure of the eye. And of course now I want to know, how does the opacity come to crowd the eye?
Okay, so a cataract can be caused by quite a number of things actually, and we usually like to classify a cataract based on the cause or the etiology. It might be congenital. Some children are born with cataracts. On day one, the child has a cataract. And some of the things that cause congenital cataracts is that if a mother had any sort of infection during pregnancy, if they had any sort of diseases, let's say like diabetes or metabolic disorders, those predispose.
Which metabolic disorders?
The most common we have in our setting is diabetes. So any infection that happens during pregnancy, or a mother has other systemic diseases, that might predispose the baby to having a cataract. So they might be born with a cataract on day one. But also it is possible that the baby is born with a cataract, but then the parents don't notice. That is why it is very, very important to do a full body checkup for the baby. And in the full body checkup, the eyes are also very important.
I usually see midwives touch the baby just very fast and they leave. Now, how do they examine for this cataract in these babies? Because they are very young.
Yes, so in examining babies, the most readily available tool is a torch. Yes, so when you use a torch and you shine it.
Being used on people who have died.
A torch? Yes. But this time round we are checking a baby and the baby is alive. Okay. But yes, we are using that torch and then we are going to, check in the baby's eye. Now, many times what can be obviously seen is something white in the center of the eyes. So when you look at my eye, you will see as though there is something black completely on the surface. But when there is a cataract, as we've described, is that the cataract is inside the eye. Is inside. So when you look here, generally speaking, when I look at you, I'll see something black, okay? But it's not true that the surface is black. The black is actually being reflected from the inside part that we call the iris. And then right here at the center, we have a pupil. Now this is where we are going to see the cataract. So this place will appear white. Okay, so we still have this. So when we touch, we shall see something white in the center and then surrounded by black. Yeah, so that is the easiest way of telling a cataract. Yes, and but definitely if it's someone who has more knowledge in ophthalmology, they can use more or better devices like a direct ophthalmoscope to check for the reflex. But generally speaking, a torch can do a lot. It can help the midwife or the person who is handling the baby, or even the mother, to check the baby's eye, you know. So I was saying sometimes that cataract is not identified immediately at birth, but then it is there. Okay. Now, for some of the times, the mother is going to see that the baby does not pay attention to light. They cannot follow light, you know. That even if there is a brightly something that has attractive colors and they would expect the baby to follow it, the baby is not able to follow. So that is one thing that mothers usually notice and like, oh, we actually need to take this baby for a checkup. Now, it is very, very important for us to detect congenital cataracts as early as possible. As early as possible.
If
Because
not, if we are not able, for example, if we delivered from the health center field and maybe they have been rushing and the mother, and the mothers, of course, maybe, you know, there is always some hiccup in the services. Mothers are so many, examining one infant per infant, it may take a lot of time. What could be the complications in the near future for those children actually who are born with congenital cataracts?
yes, so for congenital cataracts, the reason we say it is very, very important to identify them early is that the brain needs to learn how to see. Broadly speaking, it's the brain that sees. The eye is just like a camera. It will take photos and then it will send them to the brain. So, literally speaking, it's the brain that sees. But for the brain to see, it should learn. It goes through a process of learning. How does it learn? That when a baby is born, they are going to be exposed to light, and that light is starting to stimulate the brain, such that the brain gets to know, I have to learn how to see. Now, if at all there is already an opacity that is covering, that means the light is not entering the eye. So the brain is not being stimulated to know that I should actually see. Now, that is even worse when it's only one eye. If it's only one eye that has the cataract, that even becomes worse because one eye will learn how to see and then the other won't. And then the brain will only rely on that one eye. So if the right eye is seeing well and the left has a cataract, that means the light will go through the right, okay? But the left, there will be no light passing through. So that becomes a lazy eye. And that is something we call amblyopia in the medical term. So for congenital cataract, it is very, very important to detect them early. The earlier we detect them, the better the visual outcome when we go ahead to manage the cataract.
Wow, thank you so much. And of course, we want to welcome the viewers who just joined us. You're still live on Google Data Vision. Just like I would want to remind them that we are situated at Mackay for Gospel Church on Sapporo Kagwa Road. It's where we're talking about this important health show from. And of course, we have already explored about cataract. We've looked into the causes, the risk factors, and what exactly a cataract is. But of course, I want us to go back to the risk factors so that we can be more serious. You know, Ugandans want to know, if I did this, what would happen? If this is like this, what should I do? But most risk factors, they need more attention.
Yeah, true. So we've only talked about one category of the congenital cataracts, but then we also have what we call the age-related or the senile cataracts. So for the age-related, as we grow, there are lots of changes that happen to the eye. You realize that when you're 60 years and you look into the camera or the mirror, you won't be the same person as you were when you were 15 years. A lot has changed. You have gray hair, you have some wrinkles, and we thank God for it. That's a gift of age. But then it comes with a lot more things, some, you know, side dish or something, if I can call it. So as you grow, the lens, the natural lens, it also gets thicker, and there is more that is deposited inside the lens. Okay, so in that structure, all the age-related changes that occur to the lens, that is also going to make it opaque. So there are people who get cataracts purely because of age, and that is a normal process of aging. Yes. So for people above 40 years, a number of them will present with cataracts, or they'll come with sometimes very vague symptoms of, so doctor, you say, when I'm in bright light, I cannot see anything. But then when I'm in dim light,
you're able to see.
Yeah. Or it will be the opposite. So sometimes they won't pay attention to it, yet there is a certain type of cataract that is starting to grow. So also cataracts have different types. So the symptoms might be a little vague, or they'll tell you, now I'm able to see near and I can't see far. Okay? Or I'm now seeing through a haze. They usually describe it in Luganda, omuntu mulabira mu kifu. I cannot clearly tell out the structures on a person, and that is because you're now seeing through something that is opaque. And as we've said, that this is something that is gradually progressive. Unfortunately, some of them wait until they are completely blind. You know?
Goodness.
Yeah, which is not good, because cataract is it's an irreversible cause of blindness, you know, and that is why this trait is actually very important. Now, the other cause of cataracts is trauma. Yeah, when something hits your eye, sometimes there might be damage that is caused to the lens inside the eye, and that can also cause it to become opaque. Okay, now that can occur in children, it can occur in adults, any age group, as long as the cataract has been touched. That can also predispose someone to getting a cataract. And then the other cataracts that happen because of other systemic diseases, and those we call secondary cataracts. For example, someone who has diabetes mellitus, people who have those other metabolic disorders, those galactosides, you know, all those enzyme deficiencies. Someone has another disease and then they are also getting what? A cataract. So that's why we also encourage people who have other systemic diseases. The most common in our setting is diabetes. You have to make sure that you come and see an eye doctor. Diabetes, just to give more emphasis, because it's the most common in our setting, is that besides just causing a cataract, it also poses some difficulties in managing the cataract. Okay? So that is why we encourage people who have diabetes, please, you see the physician, that is very good, but also come and see an eye doctor. It's very, very important, because the management of a cataract in someone who has diabetes, it becomes a little more complex because of the other complications that diabetes brings to the eye. Okay? And then the other things that we know cause cataracts, exposure to radiations. We've seen people who work in places where they're really exposed to UV light, no protection. We've also seen people who are being struck by lightning, developing cataracts. So yeah, in a nutshell, those are the different causes of cataracts.
So the causes can actually directly link us to the risk factors? Yes,
but yes, the risk factors, age, increasing age predisposes to cataracts. People who smoke, you know.
Let's talk about smoking.
Smoking, there are lots of toxins that are contained in the tobacco smoke. Okay. Now, for us to be able to keep the lens clear, there are lots of metabolic processes. There are lots of nitty-gritties that happen to actually keep the lens perfectly clear. And one of the important things that we need is antioxidants, okay, to make sure that the lens is perfectly clear. Now, with smoking, there are lots of toxins that are also reducing on the, antioxidants that we have. So the rate at which your cataract is going to grow is going to be much faster compared to someone who is not smoking. The other category of people who will have fast progression with cataracts are people who have poorly controlled diabetes. Those will also have a faster progression of cataracts compared to people who have fairly well controlled diabetes. But also the longer the duration of having diabetes,
The more.
yeah, the higher the risk, you know. And
How
then
about people who drink alcohol?
yes, drinking alcohol, well, I should say there might not be any direct relationship, but I know a lot of alcohol consumption is not good. It definitely causes a lot of wear and tear to the body. Yes, so I wouldn't advise people to be consuming binge. Yeah, it causes a lot of wear and tear to the body and lots of toxins that you're taking into your bloodstream. And the other issue is a family history of cataracts. Now, it's important for us to know why people are blind in our families. Sometimes that is something we overlook, not until you realize that, oh, I had my grandfather, he died, he was blind. My grandmother was also blind. My auntie is blind, and we don't know why are these people blind. You know, sometimes there are diseases that run in families, and they might predispose you to having cataracts. So if you have a positive family history of cataracts, that might also increase your chances of having cataract as a person who belongs to that family.
Wow, thank you so much, Dr. Angela. And for the viewers, just like you all learning like me, I'm a newcomer in this session. And of course, we are all learning about what cataract is. And we've so far looked into the risk factors, the causes. And most importantly is that screening looks like to be very important because every person has eyes, literally. You might be a candidate actually and don't know. Now we're going for a short quick break. But when we return, we shall look into the prevention, the treatment modalities that are available, and also help the people who already have this condition to live healthier and better. See you shortly.
Good Day TV, transforming your life.
Bakola bulungi emirimu gyabwe miyonjo genuine estate yagala ettaka okutalinkayana yadde ennyombo genuine estate genuine estate.
Oyagala ennyumba ey'ekirooto kyo, factory oba z'abapangisa, faamu yakulimirako oba yakulundirako, kyogere tukikuwe n'ekyapa mu ngalo. Tulina ettaka mu bibuga n'ebweru w'ebibuga. Ffe wano ku Genuine Estates Uganda Limited tupima amataka n'okkuba pulaani z'amayumba. Tusangibwa mu tawuni y'e Wakiso ku Genuine House, Hoima Road. Tufune ku 039 oba 0759955526. Tukoleyo wamu oganyulwa kinene.
In the neighborhood, near stagnant water and mosquito breeding sites, malaria lurks, always waiting to strike. But fear not, for here comes Mr. Vaxa, the ultimate protector against malaria. For years, malaria has been one of the biggest threats to children under 5, making them weak and even putting their lives at risk. But now, the government is introducing a new solution, the malaria vaccine. The malaria vaccine is now in the routine immunization schedule. The malaria vaccine is administered in 4 doses at 6 months, 7 months, 8 months, and 18 months. This vaccine will provide extra protection against severe malaria. And don't forget, routine immunization protects children from many deadly diseases. Every vaccine matters. Visit the nearest health facility for routine immunization services today. Mr. Vaxa, the malaria vaccine is free, safe, and ready to protect our children. Will you join the fight and complete all 4 doses? For more information, call the Ministry of Health on 0800 100 066. This message is brought to you by the Ministry of Health.
Good Day TV, transforming your life.
you so much for watching Good Television, for being here with us. Just like we are streaming live on all social media platforms, including LinkedIn, Facebook, Twitter, and of course, when you go there, just put Good Television Uganda. But we are also live at Makefro Gospel Church. We are located at Sapo Kagwa Road here in Kampala. So you can find us, interact with us, but also we are a Christian-centered family. That's the most important message I can tell you. So yes, we're talking about cataracts, and I have Dr. Angela. She's a young, vibrant, actually, specialist with Mengo Hospital. Don't see her here just for just. She's a very senior specialist in this field. So we had already talked about risk factors, causes, and you explained very well using this eye model. I'm happy to see the eye model for my first time. And of course, I know viewers have enjoyed seeing it, but also learning about how it works and operates and how actually cataract can develop within yourself. Now, what are some actually statistics, maybe what's the problem magnitude that we can base on to say that yes, we have to be serious with cataracts?
Okay, thank you very much, Mr. Kamara. Now, one thing we need to know is that globally, cataract is the second leading cause of reversible blindness globally. But also in our setting, cataract is the leading cause of reversible blindness. Now, when we come to individuals among 40 years, cataracts, it actually becomes a very, very big problem, because just like we've said, this is a process that comes with aging, okay? And many times the cataract obscures or it closes a path or the area that we are supposed to use to examine an individual, to make a complete examination of the eye. If I can expound on that, is that the cataract, literally speaking, it separates the anterior part of the eye from the posterior part of the eye, okay? But when we have this cataract blocking this place, that means as an eye doctor, I won't be able to access the back of the eye. Now, besides the problems that the cataract itself brings, it is also allowing other challenges to develop at the back of the eye undetected, because we won't have a path to examine the back of your eye. So in individuals among 40 years, it's not just about the cataract, but it also causes attention to the entire eye, because we have to keep doing routine, examinations to also look at the back of the eye. But yes, cataract is a leading cause of reversible blindness, also in our setting.
Wow. So let's get serious when it comes to cataract. Now, I want to know what could be some of the treatment modalities. Do we begin with treatment or prevention? Prevention.
Well, for cataracts, there is a lot we can do to prevent, but at a certain point it's out of hand. Just like I said, that majority of the patients who come to us with cataract, it's age-related, and I don't know of a pill that we are going to swallow to remain younger. Yes, I've not yet known about that pill. Oh, well, we shall see. But yeah. So for prevention, one, for mothers who are pregnant, if you have any slight fever, an infection, please go and see a gynecologist, go and see a doctor. That visit you're going to make to the hospital is going to save your child's eyes. Don't take anything for granted. Okay, so please go and visit a doctor. Let that infection be treated. You're not only helping yourself, but you're also helping your baby. And then, in cases of trauma, many times people get trauma, something has hit my eye, and then I just start buying any, eye drops that have not been prescribed. And that brings me back to something I forgot, that certain drugs increase the risk of cataracts. And one of those is the most commonly prescribed dexamethasone, hydrocortisone. People like going to pharmacies and buy your Dexa.
Gender eye drop.
Those steroids increase the risk of developing cataracts. So please avoid self-medication. Yes, we prescribe steroids, but we prescribe them when we have weighed the benefit versus the risk. To a layman, they'll just bite us black. You're going to use a steroid for 6 months, you know? You're not worried about anything, but as an ophthalmologist, I'm worried about a lot, you know? So please avoid self-prescription. And that is also very common among children with allergies because they use a lot of steroids, you know? Dexona, Dexa something, you know? X-beta, you know? Yes, we prescribe them, but we weigh the risk, and then we also give it for a certain period of time. So please do not do self-prescription, okay? And then the other thing in prevention is early screening. You have a baby has been born, please feel happy to bring the baby for, you know, an eye checkup. That is something that we should get used to, you know. Let the baby be checked, at least with a torch, bare minimum. And also to the mothers, be interested in looking at your baby's eye. I know grandmothers usually go for specific parts of the body when a baby is born. But yes, let's also start paying attention. Let's start paying attention to the eyes also, you know. Yes. And then the other in prevention is controlling our sugars. Controlling our sugars, yes. You have diabetes, you know, please make sure your sugars are controlled. I know it's not as easy, you know, we talk about it plainly speaking. You know, putting sugars under control is not that easy, but it takes a lot of, you know, multidisciplinary efforts. You're the patient, your doctor, the people around you, you know. Yes, but it is very, very important for you to control the sugars. The other about age, well, smile and appreciate God. Yes, you've given me age, and these are the other gifts that follow. And just come to us and, you know, we shall give you advice on what we can do. So now, if I can proceed to talk about the treatment modalities. So for the treatment modalities, when we have sort of criteria or things we consider before we say this, we are going to treat a cataract, because there are some cataracts that we call, let's say, like there might be no benefit in treating it, or the inoperable cataracts. There are some that have become more complex, but plainly speaking, a child that has a cataract, it's an emergency. Yes, it's an emergency. The moment you have a child who has a cataract, it is an emergency. That is a child you should not sleep with in the house after you've known that they have a cataract. You should be on your way to the doctor. Huh? You should actually be running. They should call an ambulance, I think. But that is an emergency. Yeah, so in treatment of cataracts, there are some we are going to observe, more so for children. But it will be the doctor to tell you, not for you to assume, okay? So there are some we shall examine and be like, oh, for this, we hope that maybe as the child is growing, it may reduce. Those exist. But also there are those we shall say, for this one, we must remove it as soon as today or tomorrow, okay? And then, that is in the category of children. And then, we can also give glasses. As I said, that a cataract is slowly progressive, you know. Sometimes a patient will come to you and the cataract is still a little small. Plainly speaking, we say it's still young, okay? Yeah, that if I give you glasses, your vision improves and your vision is very good. So we shall be happy to give you glasses. But then there are individuals that even if we give you glasses, your vision is still poor. And then when the doctor examines you, they will find that there is no benefit in you having what? Glasses. So now there we go to the next treatment modality, which is surgery. Okay. Now, let me try to elaborate what we do while doing cataract surgery. I'll explain the most common There are many methods, but I'll try to be as plain as possible. So when we are going to do cataract surgery, as I said, this is the eye. So we may make a small cut. I say may because, I mean, there is a lot of technology that has come in, and sometimes you don't actually need to make a cut. But the baseline principle is we are going to enter the eye, remove this opaque lens, okay? Put it aside, we throw it away, and then we put a new lens inside the eye, and this lens is clear. So we have removed the opacity, and we have put a new lens. And this is a lens that you're going to stay with for the rest of your life.
So what if it also gets a problem?
Not really. This doesn't get a cataract per se. Okay, it doesn't get a cataract. So this cataract cannot grow back, no, because now we have an artificial lens. Please don't be scared about this artificial lens. It's inert. It doesn't react with your body. The way it was made, it does. The way you see people move comfortably around with heart valves, you know, and you won't know that someone has a heart valve.
But there are things they will do and other things they will do.
Yes, but it's hard for you to be moving around and, you know, so you know that Kamara has a heart valve. No. So it's inert, and it's, when the lens is inside your eye, and it's painless. You shouldn't notice that you have a lens inside the eye. Yeah, but the eye doctor or the specialist will notice if they examine, and they will tell you, oh, you've ever had cataract surgery? Yes. So we remove it and we put a new lens. It is a very, very safe procedure, okay? It's a very, very safe procedure. And yes, when your doctor deems it necessary to do the cataract surgery, that is what we literally do.
Wow, thank you so much, Dr. Angela. You've been such an important guest to us, and of course sharing with us your expertise here in Good Television. But I want to ask you something. You see, there are many glasses on roadside and wherever. Could wearing such glasses protect our eyes from getting cataracts? Because I see glasses everywhere. Every person actually is putting on glasses. I don't know whether some medicinal, others are just maybe for pose, beach, I don't know. You could please guide our viewers.
Yes, so glasses don't protect you from cataracts. They don't. So, and this brings me back to some patients who will come and they tell you, doctor, for me I want glasses. Don't touch my eye. I purely want glasses. But this is the thing. If you have an opacity that has covered this place, okay? Even if I give you a glass and I put it in front, but then inside here, there is an opacity and light can't pass through, still you won't see because the opacity is still there. Not until this has been removed and we have put for you a clear lens, that's how you're going to see. And after cataract surgery, we can give you glasses. So these glasses people keep buying around. We don't know how strong they are. We don't know how weak they are. No, they don't protect you from getting cataracts. If anything, they may actually cause you more harm because we don't know how strong they are. You know, they may just give you more strain. So you only get glasses when they have actually been prescribed for you, not moving around and buying glasses from all over the place. So glasses don't protect you from cataract. No,
wow.
They don't.
I actually enjoy seeing people putting on glasses, but on my eyes I feel I am burdened. I feel I'm burdened. Whereas I see people who have them and I say, wow, people look good. Now I have a question. As a person, I feel maybe cataract has been neglected for the last many years. What's your call to your specialist people in field? And where can we access these services? Because you are speaking to me, I'm from Kanum district, and my nearest hospital is Kambuga Hospital.
Yes.
I'm not certain we have an ophthalmologist at Kambuga Hospital. And now you are speaking to a multitude of people. Where can they access these services?
Okay. Yes. So actually, quite a number of strides have been made in regards to cataract surgery, and even Ministry of Health in the 5th Strategic Eye Health Plan. One of the goals was to increase the cataract surgical rate. from 256 to around 400 by 2026. So that shows that the government is actually interested in this specific topic. Okay? Yes. And a lot of efforts have been made through different camps that are done in communities to do surgeries for people, but this should be safe surgeries. Because doing cataract surgery doesn't stop at making the cut, removing the cataract and putting a new lens. It also trickles down to taking care of the eye, monitoring the outcome. So we are no longer at a point where we just say we are just going to do for someone cataract surgery. No, we also mind about the quality. So a number of the regional referral hospitals have ophthalmologists, and cataract surgical services are being offered in different, regional referral hospitals. But I still believe we are not yet there.
Yes, we are.
We are not yet there. It is so sad receiving a patient, an 8-year-old female who has been blind for like 30 years. And the cause of blindness is a cataract. That is something in this time and era that makes us as eye specialists feel so sad. That is someone who has lost 30 years of their life. If you're 80 and you've had a cataract for 30 years, what would you have done in those 30 years?
Nothing.
So if you had very good vision, you would have done a lot. But this is something you've had for 30 years, and yet it can be corrected. That is the saddest part of it. And those are people you operate, and they'll be like, oh, I have beautiful nails. Such small things. You operate them, they're like, oh my God, I have been behind for 30 years.
And now they're in front.
And now they are seeing. So doing cataract surgery, it is not just about someone seeing, but it is restoring someone's dignity. Someone is able to go back to work. Yes, they are 80. They want to go to look for food or work, but they'll be able to take themselves to the toilet.
You can see that brand.
Yeah, they'll be able to see that. They'll be able to see their food. So cataract surgery is actually a very, very important service. It changes lives. It restores dignity. It transforms society. A 50-year who is not seeing, and it's purely just because of the cattle. That is someone who would be somewhere, looking after their cattle, but they won't be able to see their cattle.
It's true.
You see, yes. So we still need to make lots of strides to increase the cataract surgical coverage in Uganda, such that we reach a point when, no one is blind because of such reversible causes.
Perfect. Thank you, Dr. Angela. What is your call to the viewers, the communities, especially the people in Mayuge, in Katakwi, in Palisa? Those are the good villages. They are not good villages, or they are most extreme ends in the country. What's your call to the communities?
My call to the communities is that vision is very, very important. You never know how precious vision is, not until you lose it. So at any one point T, for whichever small thing that happens to your eye, please visit a health facility. A health center has a clinical officer.
Health center has a doctor.
Yeah, and a clinical officer, someone who has, studied something special about the eyes. Yes, so there is someone who can, tell you, refer you, or tell you something that you have to do about your eyes. Yes, there are ophthalmologists in regional referral hospitals, PNFPs, and some general hospitals may have ophthalmologists. But anything that happens to your eyes, please, please, please run to the hospital. Be examined by someone who has expertise in eye health, and you'll be able to get good information. And then, before I leave the show, please let's not use traditional eye medicine.
I wanted to ask about herbal drugs. Please highlight about herbal drugs, whether drinking them, whether applying them in the eyes. Thank you for calling upon the community.
Traditional eye medicine.
How do they power it?
It really complicates the entire thing. Because even if you come with a cataract, and I think I can manage it, but then you've been putting traditional eye medicine, they have scratched your eyes, it makes everything complex. It increases your chances of infection. So for whatever happens, please don't put those herbs on the eye. The eye is very, very sensitive and delicate.
But helped my parents.
Oh.
They used it and it helped them. Now they are recommended by the same person.
No.
Because we use these herbal medicines because we've received a recommendation from the former user. Haven't you heard such stories?
Yes, I have heard, but perhaps those are the lucky ones that I have not had that damage. You don't know what your luck is. So I don't think that is something you should try out. So please, don't use traditional eye medicines. Those really, really spoil eyes and they complicate everything. And then to people who have diabetes, these are people who are very close to our hearts. People who have diabetes, please make sure you come to the ophthalmologist, have an eye checkup before things are so terrible, such that you're able to get the best treatment. And then one special call for mothers, fathers, and people who are living with children. For a child, it is with the adult to make a decision for them. So at any one point, please try to make a decision for that little child that is going to be very important for their lifetime. A child still has a lot of years ahead and they'll need their eyes, their vision for studying, for working, for moving around, So a child still has too many years ahead. So when a child is blind, it is a lot of disability that has been caused. So please, mothers, try to look into those child's eyes. You see something white, please rush them to the hospital. Let's be able to give them treatment in time, such that we are able to get the best outcomes for them.
Thank you so much, Dr. Angela. And of course, as we intend to come to the closure of this very important program, we'd like once again to invite the public to go on the social media platforms, use them, comment, put a suggestion or question. Maybe your experience if you've lived with this condition somewhat before. Dr. Angela, what is your call to the public, to the government of Uganda?
The call to the government of Uganda is that vision is very important. We cannot talk about development when people are blind. We cannot talk about giving quality education when people are blind. No, no, no. So as we are looking at development of the country, we also need to put vision at the forefront. It should be part of the things that really have to emphasize it. Yes, yes. We need to put lots of effort towards vision. If you have people who have perfect vision, those are people who are going to do a lot for this country. We shall have less accidents when people have good sight. So vision is very, very important. So if we are talking about development, we are talking about good quality education, we are talking about stopping hunger, vision should actually be at the forefront of all this. So this is a call to government that yes, we have put lots of strategies and we still need to do more to ensure that our population is healthy and with very good vision.
Thank you so much. I said therefore Dr. Angela Jew, because now we really want people to have good vision and see their loved ones. By the way, if you don't have good vision, you don't know if the person who's loving you, how they are. I don't know, maybe. So now, do you have any regards? You want to send out some regards to people, to your friends? Please go ahead.
Okay. Thank you very much, Mr. Kamara, once again for hosting me. And yes, kind regards to Mengo Hospital and all the staff, and specifically the eye department. Thank you for the great work you're doing. And also special regards to all ophthalmologists in Uganda. And we are all brought together through the Ophthalmology Society of Uganda. Thank you very much for all the services you're offering to the population, to all clinic officers out there in those remote areas where we are not. Thank you for the great job. To the optometrists, so that people who, give glasses, do the measurements. Thank you very much for the great work you're doing. It's really appreciated. Yes, and to my friends, family, thank you. Regards to you.
Now, thank you so much, dear viewers. You've been great people since we started this program till now. And of course, your great input has been of invaluable to us as Good Data Vision, but also as the health and beauty program that is every single Wednesday at 9 p.m. We encourage you to protect yourself, prevent yourself against these ailments so that you can be developmental to your communities. Remember, prevention is better than cure, and remember, treatment is more expensive and it's not sustainable. I am Kamara Daniel, your health show host here to Google Data Vision. See you next Wednesday. Bye-bye.
Good Day TV, transforming your life.